Hi, my name is Darlin Hruska, and I am chair of the Kentucky State Council of the Association of Perioperative Registered Nurses. I am also the immediate past president of Kentuckiana Chapter 1802 of AORN. Having worked as an operating room nurse for over 32 years, I have experienced surgical smoke firsthand and have become aware of its hazards. Surgical smoke is generated by the use of equipment such as electric cautery, drills, and lasers, and inhaling surgical smoke is equivalent to inhaling the smoke of 27 to 30 unfiltered cigarettes each day. Toxic gases such as benzene and formaldehyde, cancer cells, blood and tissue fragments, viable bacteria, tuberculosis, and hazardous viruses including HPV, have been found in surgical smoke, and now the deadly COVID-19 virus can also be transmitted by the surgical smoke. Surgical nurses report twice as many respiratory issues, including asthma and bronchitis, as the general population, and there are documented cases of lung disease and cancers among surgeons and surgical nurses that were directly linked to the smoke of cases in which they were involved. The American College of Surgeons, the Association of Perioperative Registered Nurses, including the Kentucky State Council of AORN, the Kentucky Nurses Association, the Association of Surgical Technologists, the Council on Surgical and Perioperative Safety, and many other healthcare organizations recommend surgical smoke evacuation. OSHA recognizes the hazards of surgical smoke and requires employers to provide their employees with a place of employment that is free from recognizable hazards that are causing or likely to cause death or serious harm to employees. Despite over 40 years of research and documentation, Kentucky does not have legislation to protect surgical healthcare workers and patients, including C-section patients and their newborns. Last spring, Senate Bill 91, requiring smoke evacuation equipment be used on every smoke-producing surgical procedure, was passed by the Kentucky Senate, but unfortunately was not presented to the House for a vote due to the altered business of the legislature caused by the COVID-19 pandemic. I am reaching out to you today to ask you to tell your legislators and legislative candidates that you support the use of surgical smoke evacuation equipment on every smoke-producing procedure. The only safe amount of surgical smoke is no surgical smoke. In the Year of the Nurse, special attention must be placed on keeping nurses safe. Kentucky needs smoke-free operating rooms to protect healthcare workers and their patients. Thank you.